when you do blepharoplasty and you're trying to take care of the bags, bags are one thing. That's the pseudoherniation of fat um, that can be hereditary. Certainly, it exacerbates with time and age as the orbital septum gets weak. So that creates more of a dark circle under the eye. But we also recognize the fact that some people have hollowness that occurs in the nasal trough area, and just doing fat removal, which we used to do, that was exclusively what we did. Just it took care of the bags, but it also made the nasal trough worse. So what we try to do in as many as 60% of cases is take the fat that bulges medial and nasal and form a pocket and place it underneath the orbicularis on top of the periosteum to fill the nasal trough. Well, it's a little bit more dissection. It is much easier to do transcutaneously because you open you reflect a skin muscle flap to get the suturing of that released fat. You release it and then put it underneath the pocket that you've made underneath the muscle. Now, that is also possible to do transconjunctivally, and I do it. It's a little trickier, but the fact is that it increases the incidence also, just the manipulation of more tissue. I think the thing that that creates more of the conjunctival chemosis laterally is the orbicularis suspension suture to the lateral periosteum. Now that's a safety feature. It allows that the trimming of the skin and muscle, getting a better overall external skin dermatocyclosis improvement, also orbicularis hypertrophy. But that suture alone creates a little bit of a lymphatic blockage. So you increase your conjunctival swelling, which then reverts you into the more DES symptoms.